Welcome to Ask Mo TV. We're here today with Dr. Michael Wald, Doctor of Nutrition and Director of Nutritional Services at Integrated Medicine of Mount Kisco, PC. Our topic today is heart disease. What are the most common causes of heart disease?
Well, heart disease is something that everyone, unfortunately, must know about and must be wary of because it's the number one cause of death in men and women. 6 out of 10 men and women will die of a cardiovascular event. But the benefit of knowing this is that there is so much that a person can do to prevent the risk of developing cardiovascular disease. So the number one cause of cardiovascular disease certainly involves lifestyle. Not exercising regularly enough, not performing aerobic exercise at least 3 or 4 or even 5 times a week at 45 to 60-minute intervals at a level of heart rate that actually causes elevation of the heart rate between 65 and 75% of the heart rate's maximum. A person should discuss with their doctor what the proper target heart rate zone is to improve blood vessel health, which means preventing blood vessels from getting too hard, which is called arterial sclerosis. That's heart disease, which can cause everything from hypertension and be associated with clogging of arteries. And then there's, of course, looking at the diet, the intake of trans fats, which are very bad fats, as well as saturated fats and cholesterol in foods will raise one's cholesterol and other types of undesirable blood fats or lipids, such as triglycerides and LDL or VLDL forms of cholesterol. The more you have of these lipids in your bloodstream, the thicker your blood is, the more predisposed to clogging of the arteries, and the higher one's risk of cardiovascular disease. But also, the deficiency of a variety of other specific nutrients is known to increase cardiovascular disease. For example, low levels of vitamin D, or what are known as suboptimal levels of vitamin D, which means your laboratory work shows that your vitamin D level is within the normal range, let's say on a scale of 30 to 100, and you might be a 40, but the studies show you should be a 70. And by being a 70 in terms of your vitamin D level, you dramatically reduce your risk of dying of an adverse cardiovascular event. There are also B vitamins, which are particularly important for avoiding heart disease and vessel disease of different types. B12, B6, and folic acid are particularly important for reducing both heart disease and stroke risk. Just taking these nutrients is not enough, or eating well is not enough. One needs to look at laboratory work to make sure that your dietary and your nutritional supplement efforts are actually working. We don't want you to get surprised with a heart attack. And then there's inflammation. The role of inflammation in all disease is very well known now, but it's particularly important to understand in cardiovascular disease. Cardiovascular disease is an inflammatory disease. And you might be thinking, but I just said that poor lifestyle and cholesterol and diet and problems there are causes of heart disease. That's true. But problems with the diet or exercise in the ways I've just mentioned and genetics tends to predispose a person to inflammation. And inflammation tends to cause all of these different cardiovascular problems. So those are just some of the potential causes of cardiovascular disease.
Does the existence of heart disease show signs immediately, or can it lie dormant for a while before surfacing? Is there a specific age that a person should become conscious in preventing heart disease?
Excuse me. If a person has cardiovascular disease in their family history, they should be well aware that they're at risk, and they should see their doctor and nutritionist to look for early signs before symptoms show up. You don't want your first symptom of cardiovascular disease being hypertension or a heart attack. So if you look at the lab work, you might see high cholesterol, you might see low vitamin D, you might see a high level of what's known as C-reactive protein, you might see a high level of something called homocysteine. These are just, of course, cholesterol, VLDLs, or a high cholesterol HCl ratio. These are very common examples of tests that can let you know if you're predisposed to cardiovascular disease. Cardiovascular disease, like lots of disease, doesn't simply happen overnight. The disease process occurs over the course of time. It takes time for blood vessels to be filled with, fatty deposits, or to become harder from arterial sclerosis. So all of these things can be assessed much, much earlier so that prevention and preventative lifestyle can be started.
What nutritional activities and holistic lifestyles can prevent heart disease?
Well, what I like to tell my patients in terms of preventing heart disease is a simple list to begin with. Now, this list might change based on what the individual laboratory findings that I would look at might uncover. But in general, a person should reduce their intake of red meat and fatty foods. They should not consume any fried foods. They should not smoke. They should not drink alcohol more than probably once or twice a week and not heavily. They should be exercising aerobically on a regular basis, 3 to 5 times a week, between 45 and 60 minutes, at a shot, making sure their heart rate is in the right zone for benefit from that exercise, for cardiovascular benefit. One needs to be mindful of proper sleep, because without proper sleep, there is no rest and repair, and that increases cardiovascular disease. There are a variety of other diseases that can predispose to heart disease, so screening, that brings us to the sort of laboratory where one would want to have certainly their cholesterol and their LDLs and their cholesterol HDL ratios checked. But there are other blood lipids that are not normally checked, which could be hidden risk factors that should be monitored, known as lipoprotein A, and also measuring the sizes of LDL cholesterol. There is small LDL cholesterol and large LDL cholesterol. Most doctors just measure the total. The total could be normal, but it could be composed entirely of the bad type of LDL cholesterol, known as the small particles. Also, I screen my patients with something called C-reactive protein, which is a blood test that is more predictive of cardiovascular disease than cholesterol or the cholesterol HDL ratio is. And no screening for cardiovascular disease would be complete without what's known as a homocysteine level, and in particular a vitamin D level. High levels of homocysteine is a bad thing. That's corrected with B vitamin supplementation, and low or low normal levels of vitamin D are easily corrected through either diet or usually the use of nutritional supplements, dramatically reducing cardiovascular disease. The point is this: as you can imagine from what I'm saying, there are dozens and dozens of different tests, or what are known as biomarkers of cardiovascular disease. If you have 3, 4, or 10 of them abnormal, and you only reduce one of them to normal, like your cholesterol, well, that's not really reducing your cardiovascular disease much, is it? So it's important to measure all of these known cardiovascular markers and make sure that you correct as many of them as possible and figure out what it is you're doing in your lifestyle that's lowering them, so you know that you've got a handle on this over time.
What is the lipid hypothesis?
The lipid hypothesis is a scientific theory that blood fats or fats in the diet will raise blood fats, and those blood fats will clog your arteries. Now, for decades, this blood fat hypothesis has stated that the cause of most cardiovascular disease is fatty accumulation in the arteries. And that certainly is true. Fatty accumulation in the form of cholesterol and LDL particles, these bad forms of lipids, they do clog arteries. But the newer thinking now, which is generally accepted now by physiologists and cardiovascular people, is that the blood fat accumulation, like high cholesterol as an example, is actually not the cause of itself increasing in the blood or in arteries, but is in response to degeneration in the body in the form of inflammation. So now we believe that inflammation is the cause of most disease, certainly of heart disease, which causes the blood cholesterol and other types of fats to increase. So it's a 360 turnaround from the prior thought that it was simply a matter of fat accumulation, but that's not the case.
What is the nutritional outlook to controlling one's cholesterol?
Well, controlling one's cholesterol should be based on what is the cause of one's cholesterol increasing. First of all, cholesterol is only one of those biomarkers, only one set of tests, so it's not everything. But in the area of cholesterol, the diet only impacts blood levels of cholesterol by about 20%, and not any more than that. Most people think that their diets are the exclusive cause of their high cholesterol. And they'll say to me, Dr. Wald, I cannot understand how or what else I could be doing in my diet. I'm a vegetarian, or I don't eat red meat, I don't eat eggs. How can my cholesterol be high even though my diet is so good? Well, I would say to these particular people, well, if that is true what you're saying, then obviously we need to look somewhere else, and it simply is not diet. Diet is not everything. Stress alone can increase cholesterol. That's right. Stress affects inflammatory mechanisms and can cause the body to produce too much cholesterol. But it's getting back to the diet, though. It's saturated fats in the diet that raise cholesterol levels in the body much more than cholesterol actually raises cholesterol in the body. So once again, saturated fats in the diet raise cholesterol in the body by between a few percentage points to maybe 20 percentage points. Cholesterol raises in the diet, cholesterol levels in the body, much less than saturated fats. But also refined and processed foods such as white flour-based foods and sugar of all types, refined and processed sugars in the form of desserts and carbohydrates like pastas and the table sugar, sucrose, and candies, they also increase blood fats, particularly triglycerides. And then, of course, there is inflammatory foods in the diet, which could be the foods I just mentioned, or red meat products, which can raise cholesterol either by being inflammatory promoting or because of their saturated fat content. So those are just some examples. But there are many people that their cholesterol and other fats can increase even when they're eating healthy foods, because these foods aren't particularly healthy for them. So that's just something that a nutritionist has to help figure out.
This has been Dr. Michael Wald.